No, go ahead.
Healthcare is a rich man's game. I'm a doctor and a rapper, and I know the master plan. If you ain't got the dough, just don't worry about the bill. Just take it to the White House on Capitol Hill. Healthcare is a human right. Said healthcare is a human right. Said healthcare is a human right. Said healthcare is a human right.
I think everybody should have health care. I think it's a right, not a privilege. And I believe that we need to support President Obama and our congressmen. We need to let our congressmen know that we are supportive of health care for all.
All most people have to do is really look at their personal lives, and they have a story, or listen to their neighbors, or look at the news, and realize that this issue should never have been diluted, and the negative attacks on this issue should have been tolerated. So I think that what most people can do is really just come out and speak to this in a positive way, and show that we're behind this to make our country grow stronger. And we realize that we cannot grow stronger when our citizens will be weakened by lack of health care and being able to take care of their health.
I was born and raised.
I'm here today because health care needs to be passed, but whatever is passed is not going to be the final step. What we need in this country is a single-payer national health care system. And until we have that, we're not going to achieve the goals of affordability for everybody or access for everybody. There is some possibility that the current act will correct some wrongs, like pre-existing condition exclusions, rescissions, people that have paid for health care but then when they get sick are denied health care. I think this bill will do a good thing in terms of correcting that problem. But until we have a public plan and take the 30% waste that we pay the insurance companies to deny care, to advertise for drugs that we don't need, and to, frankly, create exorbitant salaries for executives that do nothing but basically collect premiums and deny care, we won't have fair health care and we won't be able to cover everybody.
If your kid gets sick or something like that and you don't have any insurance in that, and your job's not paying you as well as it's supposed to be paying you, just figure out what that bill is going to be for that child. I hope that never happens to anyone, but that's exactly one of the most important scenarios out there. Your child gets sick and you don't have a health care plan of some sort, you can't afford that. I don't care who you are. You may have a lot of money, but when they get done with you, you ain't going to have no money.
What I think people should do as far as making their decision is really be realistic. Be realistic about our country and the needs of people. We have our uninsured population in this country is worse than a third world country at this time, and it should not be like this. I feel as though people who are anti, to just take a moment to look at it, because I feel as though a lot of these people that are anti or against this healthcare reform movement are doing it out of possibly just dissension against maybe our current political leadership in Washington, and not the fact that this is not needed. So why delay it? Why delay it and politicize something that is affecting people's lives?
People believe that the government cannot run healthcare. We have Medicare, we have the Veterans Administration, we have Medicaid, all these programs that help people. And the reason why so many people are covered today is because we have the government involved. And yet we have people saying, well, we don't want the government screwing up our health care, and yet the government is running health care and running it well, and people need to recognize that.
My understanding isn't the flu shot run by the government, and it's something to see the number of people who are standing in line to get the flu shot, and especially with this H1N1, and that's funded by the government. So come on, people. The health care plan that they're trying to get is going to truly help some of these people that are out here suffering so they can have health care service.
Outside looking in America, I just can't win in America. I think it's a sin in America.
People need to talk to their friends and neighbors. People need to organize themselves in their unions, in their churches, in their neighborhoods, and they need to invite people like myself from all sides of the issue to come out and talk to them about how we're going to pay for it, how we're going to protect health care as a fundamental human right. And once those discussions are had, I'm confident that people will become more comfortable with what we really need to do and who we really need to be as a nation.